Hello everyone, welcome back to our channel. Again, my name is Sir Joel and welcome to the third part of our video series about nursing process. Today, we will be discussing the third phase, which is your planning phase. Medyo mahaba po ang topic na ito, but I hope you will stay and watch the video because this part is very important in creating now your NCP or your nursing care plan. We do have a future video for nursing care plan, so pakiabangan po natin iyon. But before we continue and discuss the actual topic itself, don't forget to subscribe to our channel, of course, and watch our videos. Of course, like and comment to our videos and share it with your friends. Now, let's go to our discussion. Planning phase. As I have said earlier, planning phase is a part or another phase of your nursing process, which is the third phase after your assessment and nursing diagnosis. So let's define what is planning phase. According to the book of Cozier, planning phase is a deliberative, systematic, phase of the nursing process that involves decision making, okay, and problem solving. Decision making and problem solving. And it is use of clients' assessment data and diagnostic statements for the purpose of creating or formulating the client's goal and designing the interventions to achieve the goals that we will be setting as part of the nursing process. Again, let me just emphasize the definition there. It is a systematic and deliberative part or phase of the nursing process that is based on the assessment data and the diagnostic statements, which will now be used to formulate the client's goal and to design the nursing interventions required for the client's condition. So that is your planning phase. According to our book, when we talk about planning phase, there are several types. We have actually three types. Number one, there is your initial planning, followed by your ongoing planning, and the last one is your discharge planning. So what is the difference between these three planning? Okay, so these three plans actually depends on what type of assessment are you doing. Okay, so when you are actually doing your initial assessment, we are actually using your initial planning. So what are the things that we need to do based on the initial data that we have collected during the assessment phase? So commonly, ginagawa po ang initial planning when the patient enters the OPD room or the ER, okay, or the emergency room, or during the first hour of the patient in the ward. So that is what we call as your initial planning. So any plans that we create based on the initial data that we have collected, commonly done during the OPD and emergency room entrance of the patient, and of course in the first few hours of the patient in the ward. While your ongoing planning is based on the ongoing assessment. So based on the ongoing assessment means to say that you are doing ongoing assessment if you are already updating the initial plan. Okay? If you are updating the initial plans. If you are already updating the initial plans based on the current assessment that you have collected with the patient, you are trying to come up with the plan or the goal that you want to get during that time. That is what we're referring to as your ongoing planning. And discharge planning are the plans that we want the client or the patient to achieve after the patient has been discharged from the hospital or pag siya po ay pinauwi na, okay, upon discharge. So it means to say that the patient is still in the hospital, but we are already creating a plans that the patient needs to accomplish later on once he will be discharged of the hospital. Okay, and it will be reassessed afterwards. For instance, if the patient were asked to come back after 7 days or after 30 days. That's the time we're going to reassess this goal if this were achieved or not, based now on the findings that we will able to assess when the clients come back from discharge until the time that he needs to go back to the hospital or to the clinic for reassessment or evaluation of his condition. Okay? So again, ginagawa po ang discharge planning kapag ang pasyente ay papalabas na ng hospital. O ito yung may mga may go home. Okay, may go home status with a doctor. Commonly, it includes about medication regimen, okay, medication regimen, okay, about rehabilitation, okay, rehabilitation, okay, and recovery, okay, recovery activities, okay, activities. So these are the common things na ginagawa na parte po ng ating discharge planning. So those are the types of planning under your planning phase. Again, initial planning is based on the initial assessment or information that we have collected, commonly done during the entry of the patient in the OPD or in the ER, or during the first hour of the patient into the wards. While ongoing planning are any things that you need to update based on the ongoing assessment while you were handling the patient. And discharge planning are commonly plans directed towards after the patient has been discharged from the hospital, which commonly includes medication regimen, instructions, rehabilitation, and recovery activities, and to include your healthy lifestyles. Okay, so those are the types of planning. Okay, let me proceed. Concepts about your planning. When we talk about planning, it is actually directly related to the creation of your NCP, or what we call your nursing care plan. So what do we mean by nursing care plan? Nursing care plan is basically the activities that we have set with goals that we want to achieve based on the client's response. Okay, so that is your nursing care plan. Now, nursing care plan can either be an informal or a formal nursing care plan. So number one is informal nursing care plan is a strategy for action that exists in the nurse's mind. It means to say that it's not in black and white. Hindi po natin siya isinusulat or nire-record. Okay, it only exists in our mind. Like for example here, the nurse may think, Mrs. Fan is very tired. I will need to reinforce her teaching after she is rested. Or for example, Mrs. Fan is febrile at the moment, or hyperthermic. So I want her temperature to go down to the normal level within 3 hours, or within after 30 minutes of management. But if it's only present in your mind, we will consider that as an informal nursing care plan. The other type of nursing care plan is the formal nursing care plan, which is either a written or a computerized nursing care plan that organizes information about the client's care. Okay, about the client's care. Like for example, the most obvious benefit of formal written care plan is that it provides for continuity of care because it is recorded. Like, so it can also serve as means of communication. Okay, a means of communication between and among other healthcare professionals. Okay, other healthcare professionals, because it is recorded. Anyone can actually read it. Any member of the healthcare team that's involved with the patient's interventions or management can read it, and also based on it, okay, and they can also use that in as a guide for them to deliver nursing care or interventions to their clients. So that is your informal nursing care plan and your formal nursing care plan. One that is not written and one that is written or recorded. Okay, recorded, written, or computerized is your formal, and only exists in the mind is your informal. I hope that is clear with everyone. Now, for formal nursing care plan, these are standardized care plan. It can either be a standardized care plan. What do you mean by standardized care plan? So standardized care plan are care plans or nursing care plans that specifies nursing care for groups of clients with common needs. Like for example, the hospital will create a standard care plan for patient with Alzheimer's. The patient or the hospital will create a standard care plan for patient who is suffering from like for example, hyperthermia. So ibig sabihin, once the patient had experience, or once the institution has a specific patient with these specific conditions, okay, specific conditions, we will follow a standard care plan created by the facility or by the institutions where we are working. Okay, where we are working. So, and that is written as part of the policy and guidelines that nurses and other healthcare professionals in the institutions is using. That is your standardized care plan. It means to say, for as long as they have the same needs, common needs, like for example, age group, common disease, common age group, or among a particular age group, lahat sila ay buntis or maternity care, like for example, okay? So we have to follow these certain types, okay? Certain types of interventions according to our standardized care plan, okay? While the individualized care plan naman po, tailored to meet the unique needs of a specific client. Though we know for a fact that patients with common conditions sometimes has common interventions or needs, okay? But we have to accept the fact that there are instances that individual has individual needs as well. So for any individual needs that we have assessed during an ongoing assessment with the patient that is not covered by the standardized care plan, okay, we can create another care plan for that, which is your individualized care plan. Like for example, this is the care plan we use for patients who are pregnant, okay? But this patient, okay, for patient 1, 2, 3, lahat sila ay buntis. Ibig sabihin, there is a standard care that we use if the patient is pregnant. Ang tawag natin doon is standardized care plan. However, si patient number 3 is febrile or nilalagnat. So febrile, we will make use the approach individual care plan for this patient kasi nga yung dalawa is hindi naman nilalagnat. Okay? So that is the standardized care plan for a particular group which is pregnant, and this one has individual needs that needs to be tailored to meet it. Okay? So we have to create a specific individualized care plan for this patient. Yun po ang ibig sabihin. So standardized is a written institutional policy or guidelines that we will be using for a particular age group that the care plan is actually trying to meet. Okay, while individualist care plan is anything that may arise to a particular patient of that particular group that is not present with the other group of with the other members of the group. So ito yung gagamitin natin, your individualized care plan. Okay, so that is a formal nursing care plan as one of the care plan types that we have. So under that is we have your standardized care plan and your individualized care plan. Okay, we also have what we know. We also have what we call as your computerized care plan. So computerized care plan is already existing nowadays, especially in Western countries. Okay, at least for some, or if not majority of the hospitals here in the Philippines. Okay, so they generate both standardized and individualized care plan that are installed into the computer, of course, which is has a central located terminal at the nurse's station or from terminals in the client's room. Okay, so only few hospitals is using this in the Philippines. First, for the reason na iilan pa lang po ang train, of course, and of course it needs a lot of budget in order for this to become operationalized to all the hospitals here in the Philippines. Okay. So now another one is your student care plans. So student care plans for those students who are still studying. Student care plans are lengthy compared to the care plans that professional nurses are already doing. Okay? It's more detailed than the care plans used by working nurses simply because it is a learning activity. We have to accept the fact that students are still a work in progress nurses. It means to say that they need to learn, okay, more concepts about nursing that is already new, okay, or not already new to working nurses. Okay? And of course, pag working nurses ka na kasi, mas mabilisan ang trabaho. Unlike for a student, it is really the process na sila ay matuto. Okay? That is why it is included in the rationale is included in the format after the interventions, because we want the student to know the reason why they are doing a specific actions in developing their care plans. Okay? Kailangan alam ng mga estudyante kung bakit ginagawa ang isang bagay na to at bakit part siya ng kanyang nursing care plan. Okay? Because they are still in the process of learning. So that is your student care plans. Okay, the next topic that we're going to discuss is the formats for nursing care plan. So in order for us to better understand this, or I mean, in order for us to create a better care plan, we have to know what are the formats that are in place that we can use in order to create a proper nursing care plan. So these are the formats. So a good nursing care plan should have the following. Number one is the problem or the nursing diagnosis. Again, before we go to your planning phase, we have to go first with the first two phases, which is the assessment and the nursing diagnosis phase. So one of the format of the nursing care plan is the nursing diagnosis phase, which is based on the assessment phase, which is the first part or the first phase of our nursing process. Okay, another one is, of course, we have to have the goals or the desired outcomes. Okay, we have to have the goals or the desired outcomes. The third one is the nursing interventions that will address now the, okay, or that will now achieve the goals to address the nursing diagnosis, which is the problem. And the last one is the evaluation. Evaluation is basically the things that we need to check in order for us to know if we are able to achieve now the goals or the desired outcomes that we have set. Okay, now there are guidelines or several guidelines that we need to follow in writing a nursing care plan. So for those who are new to this one, especially if you are a student, you have to be very knowledgeable with regards to this one. Of course, before we go to the individual nursing care plan guidelines, okay, we have to, of course, remember the word, the mnemonics SMART. Okay, huwag natin kakalimutan yan. SMART is specific. So the nursing care plan or the goal that you have to set has to be specific. It has to be manageable, attainable, or manageable or measurable, attainable, okay, realistic, and of course time bound. Okay, so it has to have this four characteristics, okay, in order for you to come up with a good nursing care plan. You're smart. So specific, measurable, and manageable, attainable, okay, and you're realistic, and of course you're time bound. So for specific nursing guidelines, number one is you have to write a date and sign the plan. Okay, date and sign the plan. If you have noticed earlier, sabi po sa ating nursing care plan, the good thing about nursing care plan, writing it formally, is that we can update it, and of course it can also be means of communication between nurses or your fellow healthcare providers. Okay, so by signing and dating it, okay, it means to say that the data or the care plan was actually updated on this date, and it was updated by this particular nurse. Okay, so first, wag natin kakalimutan, it has to be signed and date. Okay, use category headings. Okay, category headings kung kanino man kung kailangan meron tayo noong problem, nursing diagnosis, okay, sa taas. Okay, later on we have a table for that. Then we also have the four we also have your goals and desired outcomes, the nursing interventions. If you are a student, we have to have your rationale, and the last one is your evaluation. Okay, we have to use standardized or approved medical and English symbols and keywords rather than the complete sentences. Okay, so again use standardized. When you write a nursing care plan, it has to be written in a concise manner. Okay, it is advisable to use standardized and approved medical or English symbols, okay, rather than using complete sentences. Okay, but take note, you have to use approved, okay, medical and standardized English symbols, okay, and keywords, um, not just use any type of words or yung mga slang words na alam mo. Okay, hindi po pwede yun. It has to be standardized, universally acceptable to all who's going to read it, na pag nakita yung symbol na to, ay ito yung ibig sabihin. Okay, so use standard. So use, make the sentence concise rather than writing the complete sentences. So use phrases rather than sentences. Later on, we will going to show that how to do that with the examples that we have. Okay, it has to be base specific. Okay, remember, sinabi ko kanina sa SMART, it has to be specific. Okay, refer to procedure books or other resources of information rather than including all the steps on a written plan. Okay, every institutions, every facility has different formats. You have to refer to them whenever you are actually new to a certain institution or facility, and if you plan to create your nursing care plan. So if you are new to this the nursing care plan and you are in one of and if you are a student, kindly ask for the format that the school is using, okay, para it will guide you in the creation of your nursing care plan. Okay, other guidelines includes tailor the plan to the unique characteristics of the client by ensuring the client's choices such as preferences about the times of care and the methods used are included. Okay, it will we will show more of this later on once we go to the examples. For another one, ensure the nursing care plan incorporates preventive and health maintenance aspect as well as restorative ones. Hindi lang po tayo more on the addressing the current situation, but we want to prevent it as well by adding preventive and health maintenance aspect to include your restoration interventions. Ensure that the plan contains ongoing assessment of the client. Okay, ongoing assessment of the client include collaborative and coordination activities in the plan. We have to accept the fact that nurses has limitations as well. There are certain things that we cannot do on our own. That's why we need to ask help from other healthcare provider or from our co-nurses. And includes plans for the client's discharge and home care needs as well. So don't forget to add this in your planning. Of course, it depends on the client situation, but these are the general guidelines that we can follow to create a formatted nursing care plan. Okay, so since we are discussing about the planning, okay, planning phase, so these are the planning process that we need to follow in order for us to come up with a better nursing care plan or the better a better planning outcome or planned outcome. Okay, the four activities or main activities under your planning process are the following. Number one, first we need to set priorities. If you did discuss our video about nursing diagnosis, there are instances that we will able to identify more than one diagnosis. It is possible with all the patients, okay, even if the patient is unique, it is possible that we will able to come up with more than one nursing diagnosis. The thing is, we cannot provide interventions sa lahat ng ito minsanan. That's why we need to prioritize which nursing diagnosis should we address first. That's why under the planning process, we have to know which problem or nursing diagnosis should be addressed first. So that's why the first of steps in the planning process is the setting of priorities, followed by establishing client goals and desired outcomes based now on the diagnosis that was prioritized. Okay, another one, selecting nursing interventions that will now help you achieve the goals and desired outcomes that you have set, and writing individualized nursing intervention or care plans. Okay, so let's discuss this one by one. Okay, in setting priorities, okay, this is establishing a preferential sequence for addressing nursing diagnosis and interventions. So basically, we want to know which nursing diagnosis should be given priority first. Okay, so in setting priorities, we have to decide which nursing diagnosis requires attention first based on this priority setting approaches. Number one, we can make use of the ABC approach. What does it mean? ABC approach means A for airway, B for breathing, and C for circulation. Again, A for airway, B for breathing, and C for circulation. Okay, so that is your ABC approach. Basically, we want to know if the condition is a life-threatening condition, okay, a health-threatening condition, or a low-priority problem. Life-threatening condition is a matter of life and death, okay? It's a matter of life and death. Health-threatening condition, it can be debilitating to the patient. It can lead to complications. It can lead to complications, okay, and also disability, okay, pag hindi naagapan. While low priority problem can be deferred or can be delayed for a few days to weeks or even months. So, ibig sabihin, ito yung mga tinatawag nating elective cases. Okay, yung mga hindi masyadong life-threatening, kaya pwede nating ipagpaliban. Of course, based on this priority setting, if the condition is a life-threatening condition, in relation to the nursing diagnosis, dapat yun ang unahin natin. So that is the ABC approach. Another approach that we can use is the use of your Maslow's hierarchy approach. So for those of you who have had their nursing theoretical framework of nursing, I know that you are familiar with Maslow's hierarchy approach. So Maslow's hierarchy approach is may alam tayo diyan, meron tayong yung inverted I mean the triangle. Okay? So the triangle which has 5 levels. So the physiologic, okay, safety and security, until such time that you're able to get the top, which is your self-actualization. Okay, of course, ang priority natin is yung nasa baba, which is your physiologic needs. Okay, so I know that you already have an idea about Maslow's hierarchy, so we're not going to discuss it with this video kasi nga masyadong haba. Okay, now in setting prioritization, aside from these two approaches, there are also several factors that can affect your priority setting. Number one, it's the client's health values and beliefs. There are instances that the client's health values and beliefs contradicts to the science of health interventions. Okay? Health interventions. That is why we have to consider it kasi nga kahit alam natin na ito yung tama according to science of intervention, if that is not in accordance with the client's belief, sometimes it will play a big role, okay, na hindi tayo magiging successful kasi aayaw at aayaw yung pasyente sa ipapagawa natin. Okay? Like for example, common example, not to degrade anyone or religious group or for that matter, okay? Like for example, there is certain religions that does not believe in blood transfusion, okay, or receiving any blood products. Okay, so in that way, kung ang paraan, okay, one of the interventions is for them to get one, makaka-apekto yon. Kung kailangan nila ng blood transfusion, hindi natin pwedeng ilagay sa planning ang blood transfusion kasi nga is against sila doon. Okay? Client's priorities. If the client thinks that the problem that was identified is not a priority, therefore we cannot do about it. Okay, take note that the client is a member of the healthcare team. Without the client, a healthcare team will not exist kasi sino nga aalagaan. Okay, that's why we need to consider the client's priority. Kailangan tanungin natin siya kung ano ang mas gusto niya ring unahin. Okay, resources available to the nurse and the client. There are instances that we will try to become ideal as much as possible, okay, with the plans that we are creating. However, we have to consider the resources available in the hospital. Baka naman po pinipilit nating i-include sa plan ang isang bagay, yung hospital natin ay may limited resources, okay, na hindi kakayanin o kaya sobrang mahal for the client. Okay, urgency of the health condition, again, if it's life-threatening or not, and of course the medical treatment plan based also to the doctor's treatment plan. Okay, based also the doctor's treatment plan. We cannot go out without considering the medical treatment plan, because as much as we want to become hero in our own way, there are certain things that we cannot do morally and professionally, and of course not not part of the responsibility of nurses. Okay, so we have to consider the medical treatment plan. Those are the factors of priority setting, or the priority setting that we need to consider as well in setting a goal. Okay, we're done with the first activity under your planning process. We are now going to go to the second activity, which is the establishment of the client's goals and desired outcomes. So this second activity under your planning phase hopes to create now an observable client's response, or what the nurse hopes to achieve by implementing the nursing interventions that we will be setting later on. So this is a second activity under your planning phase, which will now guide us on what do we really want to achieve, okay, with this nursing care plan. Now, in setting a goal, a desired outcome, we have to differentiate first goals and desired outcomes. Okay, there have been a lot of books that is trying to differentiate desired outcomes and goals. In some books, they were actually has the same definitions. Okay, well, in some books, they were actually differentiated according to the extent of if it extent of the goals, if it's general or specific, more specific. Okay, so goals are more on the broad outcomes that we want to achieve, while desired outcomes are the specific outcomes that we want to achieve. Example is that for goals, improve nutritional status. It is more on goal because when you talk about nutritional status, this is actually a vague concept. Napakalawak po ng konsepto ng nutritional. So it goes with the food, it goes with the lifestyle, it goes with the activity na ginagawa mo. While specific outcomes, example is that the patient will gain 3 kilograms by May 15. And if you try to compare the two, desired outcomes are more specific because you will be able to identify, okay, kung ano talaga yung nagbago. Unlike dun sa improved nutritional status, like I said, it's really vague. There are instances na mag-i-improve ang kanyang nutritional status. Like for example, if he is underweight right now, nag-gain siya ng 1 kilogram but still malnourished, that is still considered as improved nutritional status. Kasi nga tumaas nga naman from before. While desired outcomes is that you can put a specific measurable data that you will later on use for evaluation kung na-achieve niya ba yung desired outcome, which is commonly nandoon sa normal level. Okay, so for this time it is actually advisable to make use of the desired outcomes rather than the goal, which is a broad outcomes, kasi nga mas specific ang magiging evaluation mo later on. Because take note that the goals or the desired outcomes that we will be setting will be also the basis of the evaluation parameters later on. Okay, now for the nursing outcome, just like with the nursing diagnosis, okay, based po siya sa nursing outcome classification or the NOC. This is developed by the nurse leaders and researchers to describe the client outcomes that responds to nursing interventions. Just like our NANDA, which is your for nursing diagnosis naman. So this is the universally acceptable outcome classification, okay, which is developed by nursing leaders and researchers. Now, the purpose of goal or desired outcomes. So why do we need to set a certain goal, or why do we need to make a desired outcomes as part of your planning? Okay, bakit kailangan natin itong gawin? Number one, it will provide you a direction for planning nursing interventions. It will be a blind shot. Okay, parang kang tumitira ng tirador na hindi mo nakikita kung ano yung tinitirador mo. Okay, as if you were firing a gun without knowing kung natatamaan mo ba, okay, yung gusto mong tamaan. Okay, the reason we are setting a goal is for us to have, okay, a certain target, okay, a certain target for the interventions that we will be setting. Okay, another one is it serves as a criteria for evaluating client progress. Just like I've mentioned earlier, the goal that we will be setting or the desired outcome that we will be setting will be later on be used as one the criteria as part of the evaluation parameters in the evaluation phase of the nursing process. Another one, it enables the client and the nurse to determine when the problem has been resolved. Okay, of course, pag nakita mo na itong goal ko, and during the ongoing assessment, you were able to identify already that the goal has been met. Okay, so it can be a clearly indication na na-achieve mo yung goal mo. Again, babalik tayo sa fifth phase of the nursing process, evaluation parameter, because the goal will be your basis later on, okay, for your evaluation. And the last one, it helps motivate the client and also the nurse by providing a sense of achievement. Sometimes all we need as nurses is a sense of achievement. And whenever there are positive changes that we did for our client, it's actually a big pride for us already. Okay, same thing is true sa ating client na kapag nakikita niya na, uy, may nababago for the better sa aking sarili ngayon, I think it's I'm gonna continue what I am doing. Okay, so it will motivate both the nurse and the client. So those are the purposes of a goal or a desired outcome. Now, in setting a goal or setting a desired outcome, it can be either a short or a long-term goal. Okay, a short or long-term goal. This has been a topic sa napakaraming hindi pagkakaintindihan in terms of what is really the meaning of short and a long-term goal. Okay, maraming schools, maraming mga instructors ang hindi talaga clear, okay, or nakakaroon ng confusion in terms of what is really short term and what is really a long term goal. Okay, to enlighten this up, okay, I would like you to listen very carefully because this is a very controversial concepts in terms of the NCP. Okay, and I would like to clarify this as much as possible. Okay, let me start. Okay, so short-term goal. Okay, let us try to differentiate this in different references or from different references, okay? So that we'll able to come up with the conclusion on how are we going to approach later on kung gagawa na tayo ng short-term and long-term goal. According to Kuzier in Herbs, page 224, 224 Fundamentals of Nursing, Concepts, Process, and Practices, 10th edition of Kuzier, okay? Short-term and long-term goals. Okay, goals may be short-term or long-term. A short-term goal, okay, short-term goal might be client will raise arm and shoulder height by Friday. In the same context, a long-term goal outcome might be client will gain full use of right arm in 6 weeks. So, kaya 6 weeks by Friday. So, safe to say na sinabi ni Funda, do wala siyang exact sinabi dyan, this is more on achievable within days. This is achievable more in 6 weeks or more. Short-term goals are useful in the clients who require healthcare for short-term or are frustrated by long-term goals that seem difficult to attain who needs to be satisfaction of achieving short-term goal. In an acute care setting, much of the nurse's time is spent in the client's immediate needs, so most goals are actually short-term. However, clients in acute care setting also needs long-term goals outcomes to guide planning for their discharge to long-term agencies or home care. Especially in a managed care environment, outcomes are often set for clients who live at home and have chronic illness conditions or problems. For clients in nursing homes, extended care facilities, and rehabilitation centers. So as you can see, wala pong definite na sinabi si Kusier kung ang short-term goal ba within the day, within the shift, within a week, within this a particular time. Okay, may particular time na sinabi. Wala pong binanggit si Kusier. Let's go to other sources. According now to this reference, okay, which is from online, okay, short-term goal versus long-term goals. So when setting goals, you want to set both short-term goals and long-term goals. A short-term goal is a goal that is designed to be completed in a short period of time. Typically, short-term goals span from a few days to weeks, while it's never lasts for more than 6 months. While long-term goals span longer periods of time and can take 6 months or longer. So ang kanyang definition naman dito is pag 6 months, 6 months below that is short term and 6 months above that is long-term goal. Okay, that's according to this site. Another one is that from the American Nurses Association, okay, so an outcome is measurable behavior demonstrated by the patient nursing intervention. So from American Nursing Association, ang sabi nila, okay, this is from this site, this is the reference site. The nursing care plan is a roadmap used to guide patient care. Providers are moving towards the same patient goals. Goals are broad statements of purpose that describe the overall of care. Goals can be short-term or long-term. The time frame for short-term and long-term goals is dependent on the setting, okay, which the care is provided. For example, in a critical care area, a short-term goal might be set to be achieved within 8 hours of shift, and a long-term goal area, it might be in 24 hours. So in contrast, in an outpatient setting, a short-term goal might be to be achieved within 1 month, and the long-term goal might be within 6 months. So nakadepende daw po pag outpatient or inpatient. Pag outpatient, okay, kailangan sabi nila ang short-term goal na achieve daw within 8 hours, while in long-term goal na-achieve within 24 hours. So, yan po yung konsepto ng American Nurses Association. But, in outpatient setting, short-term goal can be achieved in a month, while long-term goal is within 6 months. So, magkaiba pa rin ang sinabi. Okay, so those are um, three references that we have cited, and they are actually telling different things, okay? Or may commonalities naman. Like for example here, pag outpatient, it's more than 6 months and less than 6 months. Short-term goal, less than 6 months. More than 6 months is long-term goal. However, in a critical care area, it's within 8 hours and 24 hours. So it means to say that nakadepende po yan sa client's condition, okay? Client's condition. And another one is the setting. Okay? If it's an outpatient or an inpatient or critical care facility. Okay? So, sa ginagamit nating book, which is based on Cozier in Herbs, wala po siyang binanggit na oras. So, it is suffice to say that in terms of setting your goals, if it's short-term or long-term, you have to ask your institution. Okay? Kung ano yung policy nila in terms of setting goals in terms of short term and long term. So for if you are working in a school, tanungin mo. Okay, tanungin mo ang iyong mga instructor or tanungin mo ang iyong school kung ano ang policy in terms of setting a short term or long term. Kung within 8 hours ba ang short term, after 8 hours is considered already long term. Okay? So, I hope that clears with everyone. Again, wala pong specific na sinabi si Cozier. Nag-specify po si American Nurses Association within 8 hours, that is considered short. After 8 hours, kunyari bukas na, that is considered already as long. But for outpatient setting, it's less than 6 months and above 6 months. Less than 6 months is short term, above 6 months is long term. So that is our discussion about how to set a long-term and a short-term goal, okay, depending now on the client's condition and depending on the setting. Okay. Now, the components of goal or desired outcomes are the following. It has to have the subject, it has to have the verb, it has to have the conditions or modifiers, and it has to have the criterion or desired performance. For the subject, so this is the client. The verb is the specifies the clients that the clients can perform. Conditions or modifiers explaining the circumstances, while the criterion or desired performance indicates the standards by which the client will perform a specified behavior. So whenever you set or create a nursing outcome or a desired outcome or a goal, it has to have these 4 components. Okay, these 4 components, which is your subject, okay, your verb, the action of the clients that we want to perform, the condition or the modifier, okay, and the criterion of desired outcome or performance. We are going to discuss these components one by one. Okay, in order for us to understand the components of goal and desired outcome better, let's go with examples. Okay, for the examples, here is an example of our desired outcome. A client will be able to ambulate unassisted with assistive devices by discharge. So, isa-isa natin. Let's try to digest, okay, this entire desired outcome into parts. Okay, for client, okay, the client is the subject, of course, will be able to ambulate, that is the action, so that's the verb. We have unassisted with devices, so basically that's the descriptive there, that is your modifier. And we have your by discharge, okay, by discharge, that is the criterion, okay, that is your criterion. So those are the 4 components in this example, okay, in this example. Another one, client will be able to drink 250 ml of fluids daily. So again, client is the subject, able to drink okay, that is your verb, okay, 250 ml, that is your modifier, and daily is gonna be your criterion, okay, criterion. So, and client performs leg ROM or range of motion exercise as taught, okay, as taught. So for this one, client, that is your subject, perform, okay, okay, perform leg ROM exercise, okay, leg ROM exercise, that is your verb, and taught, that is your modifier. Okay, as you can see, pwede mo lang yung criterion. Paglalagyan natin ng criterion to, by, okay, Friday. Okay, by Friday. So that is an example of the 4 components of a correct desired nursing outcome. Okay, so depende na po yan kung short term or long term yung goal na gagawin nyo. Of course, pag short term, depende po yan sa inyong institution. But if you're going to follow the American Nurses Association guidelines, short term is more on within, okay, within 8 hours, while long term is with more than, okay, more than 8 hours to 24 hours. Okay, more than 8 hours to 24 hours. So that is your nursing goal or desired outcome. So let us go and try to relate this with the nursing diagnosis. For example, the goal desired outcome in relation to nursing diagnosis. The nursing diagnosis is ineffective airway clearance related to viscous secretions and shallow chest expansion secondary to fluid volume deficit, pain, and fatigue. Okay, this is actually I got this from Fundamentals of Nursing. Okay, so for the desired outcome after 8 hours of nursing interventions, so that is your criterion. The patient, okay, patient, that is your subject, will be able to demonstrate effective gas exchange. Okay, demonstrate effective gas exchange. Okay, as evidenced by, these are the modifiers. Okay, modifiers. So modifiers can be later on used as part of your evaluation parameters. Meron ba siyang absence of pallor? Dapat as evidenced by absence of pallor, use of correct breathing coughing exercise, productive cough, symmetric chest excursion at least 4 centimeter, clear lung sound, respiration of 12 to 22 BPM, and pulse of less than 100, and inhales normal volume of air on incentive spirometry. So, yeah. So, kapag iyan na-achieve lahat later on, your goal is either be met. Kapag few and others are not achieved, so pwede din partially met, at pag walang na-achieve, it will be not met. So, if you're going to use this as evaluation parameters. Okay, so that is your goal setting. We are going to end the video at this moment. Okay, we are going to discuss the second part of your planning phase, which is now the creation of your nursing interventions in relation now to the desired goals or desired outcome or goals that was set. Okay, so pakiabangan po yung ating next videos. Again, para mapanood po natin yon, don't forget to subscribe, hit like, share, and comment on this video so that you will be keep updated sa mga next videos natin. Hanggang sa next videos natin, that would be all, and bye for now, fellow nurses.